common issue. Okay, when you have low estrogen, you lost your fire. Estrogen is the female, is the fire in the female, is estrogen. We are what we are. We are multitaskers. We do everything around the house. We go to work. We do well at work. Whether we are recognized or not is immaterial. We know we do well at work. Okay, better than a male compatriot maybe. And then we also come back and cook and look after our children and solve all the disputes among in-laws and family members and everything. Look after our brothers, sisters, our family. So female, we do so many things. Why? Because we have estrogen. And when you're low in estrogen, that fire slowly dies in you. Okay, and estrogen is also beauty for the woman. So the beautiful fine skin, the lack of pigmentations, the lack of even wrinkles. You can say though wrinkles and loose skin is more related to growth hormone, but sometimes low estrogen will also give you flabby skin, and you may lose the shape. I always say the female shape is like this, an hourglass, and that is because of estrogen. So when you have low estrogen, your fats are depositing in the opposite way. It deposits around your tummy, and whatever around your nice hip all goes away, and then you lose that female shape, the hourglass. And of course you start to become more hairy when you're not supposed to be hairy in those places, and you lose lubrication. So sex is a pain for you. Okay, it's causing you cracks, it's causing you repeated infections, urinary and vaginal infections. So estrogen or low estrogen is something you can't ignore. And then there's another important problem that happens with conversion of the good estrogens to bad estrogens. That happens with too much of fat deposits in the body, and also if your liver is toxic, it's not being taken care of. Okay, so in this case, you become estrogen dominant. Okay, if you become estrogen dominant, means you have the bad guys of the estrogens there, 14, 16, 18 hydroxyestrogens. And these estrogens give you the opposite effect in a way of good estrogens. They are the ones that causes you breast cancer, not E1 and E2, not the good guys. Breast cancer is from the bad estrogens. Okay, inflammation is from bad estrogens. Pigmentation is from bad estrogens. More and more weight gain and fat gain is from bad estrogens. Your cysts, your fibroids are from bad estrogens. They are not from E1 and E2. They are from E14, E16, the hypertrophic hormones of the estrogen. So a lot of times the estrogen dominance is not recognized. It's not even acknowledged by some mainstream doctors generally. Let me just say doctors. Okay, so this is something you again need to go to those doctors who recognize and learn how to recognize and treat it. Okay, and then we may be able to help you with these problems as well. Okay, so I think I touched 5. I have more hormones to talk about it. We'll do it another time.
Yes.
Yeah.
Is there some home remedy that I can do to improve or balance my hormones instead of being medicated?
It all depends on how strong the problem is. If the problem is very, very mild, then of course we would like you to do something natural. Nobody wants to straight away put you on strong hormone medications for nothing, for what? Because you're not going to feel good about it, and then you'll be angry with me, right? So I don't want you to be angry with me. I want you to love me. Okay, so basically, you can, if say for example cortisol is borderline low, then you can of course relax. You can try to eat less dairy. You can try to eat less starchy food. Eat more good, clean proteins, and eat more green vegetables and colorful vegetables and some fruits. Reduce unnecessary snacks or carbohydrates, and move more. Sometimes the body is meant to move. I'm a firm believer in that. So when you move and your mind is on different things, then you actually, your stress level will go down. Doesn't mean you have to just sit at home and look at the TV to relax. No. To relax, you need to be doing different kind of things on a daily basis, and you must be doing fruitful things for yourself and for others. Then you feel happy, and when you're happy, your stress levels go down, and then maybe the cortisol correct itself. Similarly, for estrogens also, you eat more healthy and say less stress. For low thyroids, we suggest you to eat more fish, iodine-rich things. So natural food remedies, eating healthy does help. For autoimmune, we were talking about autoimmune thyroiditis. I normally suggest to run some food intolerance testing, okay? Because when you do food intolerance testing, for your information, I have a postgraduate diploma in nutritional science. So we always advocate knowing about your food intolerances. So eating healthy, yes. Eating clean, yes. But each of us are different kind of organism. We may have specific things that we are intolerant to. If we don't recognize or we don't know about it, food intolerances are very hard to know. Allergies are easy to know. You get an itch, you scratch, you know you're allergic. But food intolerance will take 3-4 days sometimes to develop. Big symptoms like headache, dark circles, bad breath, just feeling fatigued and tired, gaining weight, tummy problems. You don't know what you're intolerant to. Then we run tests, and then we will know. If you correct your food intolerances, your autoimmune functions will also improve, and your thyroid can improve. So there are certain things that you can do by yourself, but it again depends on the level. If it's very serious and is already giving you a lot of symptoms and a lot of dangerous things starting to happen in your body, then maybe it's good to correct it for some months and then go back to natural maintenance. Yeah.
Okay, Doctor, can you please tell me what is the cost of the hormone test that you have?
Oh, it very much depends. If it is a very young person who's just having issues with menstruation, it can be about 250, 300, that kind of thing. If you are in your mid-30s, we just want to know, late 20s or mid-30s, we just want to know levels of your hormones is around 750. But if you are already going into the dangerous zone and you already have all those different issues, that some of which we touched on today, but there's a lot more, then I would suggest you not only test your hormones in full, but you should also touch on all the other associated factors, because we were talking about how inflammation can happen, how your energy metabolism can be affected, how growths can happen. Then we need to do a very full cycle of tests, and those, if you add on ultrasound scans, ECGs, everything can go up to 2,000. So that is the rough cost, but this is just a basic. And if there is anything we notice which needs further testing, because I don't put all of this inside my initial tests, like for example, autoimmune thyroid antibodies, expensive tests, food intolerance tests, expensive tests, we don't put it into the initial package. But if we notice in the first test you are having the problem, we will always offer to you, and then it's up to you whether you want to look further into that or not.
Okay, thank you for that, Doctor. Can OBGYN test hormonal imbalance?
Of course, yeah. We should be testing. I mean, I'm a strong believer in hormones, but a lot of times I notice that it is just ultrasound being done, and then a scope or removal of cyst being promoted or advised. I'm not against doing the scope or removing any cyst, but I think if we don't know the causative reason why, if we remove that one cyst, if you don't know what is causing it, another few cysts can come, and then you remove it and remove it. Why don't we know about what's happening in the body? And we start correcting it while removing That's already there. I mean, that's the way I like to go about it. And I think you also asked about men, which I've forgotten
That's
to
right.
talk
Sorry.
about.
Yes.
Part 2 of the previous question.
That's right. Going back to that.
Okay, male, similar things. I mean, uh, growth hormone issues. So then, because I think men are more indisciplined compared to women. Sorry, I would say that, isn't it? Because I'm a woman. But I think generally men are very much into their work. They compartmentalize and they don't actually. They're not very vocal about what they're feeling, or and then they eat late, they don't follow, they think what the wife is saying is just to irritate them. So I hope with all the information now available, there are many men who are starting to change now. But still they can have growth hormone issues. So one of the first things we would tell people when we notice low growth hormone is that don't eat so late and sleep in time. Okay, that's very important. If not, your cholesterol will be high, your energy will not be high, and you will not do your best at your work or perform your best at anything. Of course, thyroid hormone is similar to what female have. Cortisol hormone, or the adrenal fatigue syndrome, I think is one of those rare diseases that affects men more than women. Okay, possibly because of the way they just focus on one thing and they don't multitask, so the stress is very high and then they get all this. I see a lot of guys with man boobs and fats around their chest areas, and many of them may also be having this. Of course, the most common reason a lot of male approach me will be because they have what we call the metabolic syndrome X. Okay, so they have some early diabetes or pre-diabetes states. They have gained a lot of fat. They have black patches around the face and around the neck. They have tiny warty things coming around their neck and face, but basically the problem is the same. There is insulin resistance, and the insulin resistance is related to low testosterone. So this is a very important condition. So whether they are seeing me for their skin warts, they think that I'm magician, can remove it all. I would always point to them that it could be metabolic syndrome X, and I would always advise them to do some blood tests to diagnose that. And if we know that while removing, their warts won't come back. Okay, if we are helping them to reduce their male boobs, also the same. We can also do their test, then we will know what is the issue, and then we can treat it. Because testosterone for male is similar to estrogen for female. It is the fire, it is what makes you tick. I have guys telling me, I used to be so good at making decisions, multi-million decisions. Now when I'm driving, I don't know whether I want to go right or left at a junction. It's because my response time, my reaction time is slowed down so much. The mental power is going down so much because of the low testosterone levels. Of course, low libido, erectile dysfunctions, infertility, male-related infertility, all of this is also coming from low testosterone. And to cap it all, testosterone maintains the muscles and bones for guys. So if you want to look like the He-Man, then you need to do the test. Don't ask me for testosterone straight away, okay? I'm not giving you. You need to check your blood, go through the same physical examination and questionnaires and interview with me. And then we will diagnose you, and then we'll advise you on what has to be done. But testosterone is something a lot of guys need to look at as well. And we need to be very careful while prescribing testosterone, because if we give the wrong kind of testosterone, then prostate problems will happen. So we also need to be looking at the prostate size and everything. So there's an ultrasound necessary as well, and blood tests for the prostate. Yeah.
Having said that, to just clarify with the viewers, do you offer that testosterone treatment here?
Of course.
There you go.
I offer all the hormone
Fantastic.
treatments, including insertion of pellets, which is definitely for people who are extremely deficient and they need to do it on a long term. Then we will. I believe in bioidentical. I think to close the talk, I have to say that I believe in bioidentical. And bioidenticals, because they are more natural and they can be compounded according to what your body needs. It's not a general prescription, one fits for all. I mean, you are so small and I'm so big, how can we both take the same dose, right? So we can, according to your test results, we can compound for you. So yeah, when we give these things, the side effects are very less. Conversion at the liver to bad hormones is very less. Of course, if your liver is toxic or you are too overweight, we'll have to treat that as well before safely prescribing you hormones. But if not, we can, for most people, we can look after well by giving them bioidentical. I'm not saying if you take bioidentical, you will never get cancer or whatever. So the risk we first need to determine before we give you the hormone. So that is the reason I was saying that if you're of older age, you look at doing a full test with me. The one I said, which has got cancer markers, which has got inflammation markers, your immune function testing. It has got all the testing on vitamins, because now a lot of vitamins are deemed to be very important for the body to control inflammation, keep your heart healthy, maintain energy in the body, and even keep the hormone functions good. So the whole umbrella of tests will give you better benefit than you just choose to do only thyroid or only estrogen or only progesterone. So if we go the safe way, that is the best way.
All right, I think we've come to an end about hormonal imbalance for women, and thank you for explaining for the men as well, Dato. I guess we will continue this topic sometime soon.
Sure, yes. Maybe we, from our friends, we expect to get more questions if you're interested, and then we can pick up on those particular hormones or subjects, because it's a very extensive topic. But extensive does not mean it's difficult and insurmountable. It is. But we need to understand that from your DNA conversion to RNA, which is your basic cellular block for every organ and every skin cell, it's the hormones that is the chemical catalyst. So I've had doctors question me. They are like, oh, we are treating skin. Why is hormone important? Sometimes when I'm treating extremely severe acne, I advise people to test themselves for hormones because I'm suspecting maybe PCOS. And sometimes when I'm treating for extreme weight gain, I definitely will always test on hormones as well. And definitely if it's irregularities of menstruation or some fibroid or cyst, I will also test. So sometimes I get questioned as to what does the skin got to do with hormones? Wrong. Your melasma is hormonal. A lot of times it's hormonal. You need to know, you need to correct it. If not, why are you spending hundreds of thousands on lasers? I do a lot of lasers, so I'm not killing my own business, but I'm just talking about how important it is to know what is inside you and then do some corrective action on both. When we treat that, then your pigment goes bye-bye forever, okay? So I'll see you guys next time. Until then, bye-bye. Send us a lot of questions.